Member for Higgins has the call.
Thank you, Mr Deputy Speaker. It's not often that you come to this place and one of the first inquiries that you sit on is with regards to your expertise in your former life. So it is with a great sense of pride that I support the submission of the allergy report that has recently been handed down, the inquiry into allergies and anaphylaxis that has been termed Walking the Allergy Tightrope. I've spent a lot of my professional career dealing with families and children with food allergies. And the reason that I did this was as a paediatric gastroenterologist. I became exposed to people who were complaining about things that were affecting their life and they didn't know why. And so I dedicated my professional career to trying to understand what this new concern was, which is food allergy. And as a medical student and as a medical professional, we were not trained in allergy. And so there is a whole cohort of doctors who have had to be reversed trained in order to understand the issues of allergy. So I would like to make the comment that the report that has been handed down just this week is of immense importance because the committee members who have sat on this report have come across information that many doctors who are formally trained have not come across. And I would say that they are now experts in allergy, which is a wonderful thing for this place. Food allergy is one of those conditions that is terribly frightening for families and for the person or child who is affected. When someone is exposed to something that could be completely safe for 99% of the population, but could effectively kill you if you were to eat it, is a terribly frightening situation to have. But more than that, there are many families who have food allergies who seek help from doctors and are not offered the right advice, the right management or the right treatment. And I would like to congratulate the allergy community over the last 10 to 20 years in the work that they have done to increase awareness about this particular group of conditions and to bring light to this area that has so needed to have exposure of that information. But as a paediatric allergist, I think the most common question that I was ever asked is food allergy on the rise? And then if it is on the rise, why is it on the rise? People just cannot understand how something as innocuous as a peanut can literally kill somebody. And so I spent a lot of my medical research time trying to understand why food allergy was on the rise. And I'm pleased to say that the food allergy community, both here in Australia but also overseas, has come across a number or has delivered information for a number of reasons for why we think food allergy is on the rise. And we are at that point in time where we are now able to make some public health recommendations to help turn back the tide of food allergy. And this is a very exciting time in medical research and indeed healthcare practitioners because they have an ability to make a real difference. I often used to say to people, cancer, infectious diseases, Alzheimer's, you name it, these medical conditions have been around as long as mankind. But food allergy in particular and allergy diseases in general have only occurred more recently. And so it is a concern of the modern era. And this is a particularly interesting era for medical researchers to try and understand why something like this is occurring. And the possibility that something has only occurred in the last number of decades and that we could potentially completely eliminate it is incredibly tantalising. So I really recommend this report because what it does do is it focuses recommendations with how to move this area forward for the benefit of families with food allergy, with allergy, and for children and adults who are suffering with allergic disease. It is amazing that 1/3 of people in Australia will develop allergies over their lifetime, and so many people have problems of hay fever, asthma, food allergy, eczema, and anaphylaxis. But in Australia, unfortunately, Australia has the highest rates of food allergy ever reported. And in fact, we have coined that, unfortunately, Australia is the food allergy capital of the world. Now, Australia is a country, it's not a capital, but you get my point. And that is that we do have incredibly high rates. In fact, 10% of children aged 12 months appear to have food allergy in Melbourne, which is the highest food allergy prevalence in Australia. And over 4 million people are living with allergies, and this number continues to rise. And of course, the most common food allergy consequence that is most frightening for everyone is that of anaphylaxis. And as someone who myself, has peanut allergy, I know how frightening it can be to be at fear of having the most life-threatening condition, which is anaphylaxis. And so all that we can do to help save lives and protect lives through prevention of anaphylaxis is a very important outcome indeed. So last August in 2019, the Minister for Health, Greg Hunt, referred the inquiry into allergies and anaphylaxis to the Standing Committee on Health, Aged Care and Sport. And the inquiry looked into the prevalence, management and treatment of allergies. It was a very thorough inquiry and received 257 submissions from members of the public, doctors, parents and organisations. And I'd like to congratulate all of those submissions and for the dedicated work that these people took time out of their professional day to come and either provide a submission to the inquiry or to present in person. And I'd particularly like to thank Maria Said from Allergy Anaphylaxis Australia, Jill Smith and Preeti Joshi from the Australasian Society of Clinical Immunology and Allergy, Kirsten Perrott and Jennifer Copland from the Centre of Food and Allergy Research, and Richard Lowe and Maria Said from the National Allergy Strategy. Now, Richard has recently retired from the National Allergy Strategy, but it is very important that we acknowledge the important work he has done for advocating for a national approach to allergies. When I travelled internationally as a medical researcher, there was absolutely no doubt that we had some of the highest rates of allergic disease in the world, but we equally had the best healthcare with regards to clinical guidelines and the allergy profession working together to protect allergy patients. But more importantly, we had a very dedicated multi-centre group of people who were interested in trying to work out how to deal with allergies better. And Richard Lowe and Maria Sage should be congratulated for the work they did in coming up with this national allergy strategy. And some of the ideas that have come forward to the recommendations of this committee has been informed by that information. So there were a number of recommendations made after 7 hearings. The first was a recommendation that there be a National Centre for Allergies and Anaphylaxis in Australia to continue the work that has already been done and explain why Australia has the highest rate of allergy in the world. A second recommendation was additional funding into food allergies and anaphylaxis research, in particular funding for clinical research into oral immunotherapy trials. Now, Mr Deputy Speaker, we know that a number of families, in fact hundreds of families, are travelling to the United States and receiving care for food allergy because they cannot get that care here in Australia. And that care is oral immunotherapy. So people who have peanut allergy or egg allergy or other food allergies are living with these allergies and living with the risk of having an anaphylactic event in an uncontrolled situation. So some of these families have spent upwards of $35,000 to travel to the US for a cure for their food allergy. Now, these clinical trials at this point in time are still in the research domain here and overseas, and what our recommendation is that Australia leads the way with regards to starting oral immunotherapy trials for food allergy here so that we can provide cutting-edge research clinical trials to families who have food allergy. The inquiry report, Walking the Allergy Tightrope, has also recommended that we ensure that the Australasian Society of Clinical Immunology and Allergy receive ongoing long-term funding to continue its partnership work with the Department of Health and the National Allergy Strategy to develop minimal standards of allergy training for health professionals and to continue the good work that these collaborative organisations and institutions have commenced. Recommendation 6 recommends that telehealth funding support for doctors and allied health workers is provided so that we can have professional services and support to allergy patients in rural, regional and remote Australia. And I know myself as a paediatric allergist, I had people travelling from all over Victoria and indeed from all over Australia and even from the Asia Pacific to have specialist care for food allergy provided at the centre that I used to work at, the Royal Children's Hospital in Melbourne and the Murdoch Children's Research Institute. Recommendation 12 recommended that the Therapeutic Goods Administration provide some competitive alternatives for auto-injectors. It was made very clear that there have been issues of supply chain for auto-injectors. Fortunately, that does not appear to have happened during the recent COVID pandemic, but it has happened previously when there's been supply line issues, and it was thought that it was important that patients always have access to adrenaline auto-injectors to ensure that they remain safe. Recommendations 14, 15, 16 and 17 provided that we ensure that there's vocational education about food allergies in food service. Now, we do know that schools around Australia have made great headways in legislating to ensure that children in schools are kept safe. And in fact, state legislation in Victoria has ensured that Victoria does not take a backseat to safety of anywhere in the world, being one of the first states to legislate for food allergy. But we would like to see a more standardised approach for all states to have education in schools, and we'd also like to see consistency about educational services, vocational education about food allergies in food service. We'd also like to see consistent food processing, including the use of the vital tick. Now, it is very important that the allergen... I've been told that I have 10 minutes, not 5 minutes. I've spoken for 10 minutes. Oh, so I would like to finally conclude by thanking the member for North Sydney, the chair of the committee, and the deputy chair, the member for Macarthur. Thank you, Mr Deputy Speaker, for your indulgence. I clearly have a passion for this subject, and I thank the committee for their work.